On January 1st, 2026, couples aged 60 and older could be paying an additional $29,000 for their health insurance premium. And nah, y'all, this ain't clickbait. So for the past week, I have been highlighting the differences in between healthcare here in America and healthcare in Brazil. And this week, in keeping with that theme, I wanted to give a breakdown of how the big, beautiful bill is changing healthcare permanently. So for starters, there are over 24 million Americans that get their health care from the Affordable Care Act or Obamacare marketplaces. And these are people of all ages, all races, all colors, all sizes. These people are going to see a massive, and I do mean massive, increase for their health insurance premiums in the year 2026. So there are tax credits that are currently being paid for by the United States government that allow for subsidies, right? These subsidies allow the price of healthcare to be affordable. Affordable Care Act. However, the big beautiful bill is not only allowing them to expire, it is also changing the maximum amount of income that you need to make before you receive a tax credit. So right now in 2025, the average person who gets their health care through Obamacare or the Affordable Health Care Act is paying right around $74 a month or $888 per year. On January 1st, 2026, however, that same person is going to be paying an average of $158 per month. That equals out to $904 per year. That is an average increase of $1,016 and 114% jump in premium. Your healthcare literally doubled overnight. But that was an average person. Let's give specific examples. Let's take your favorite barista at your favorite coffee shop, like where I'm at right now. Let's say that individual makes $28,000 per year. Currently, they're only paying $27 a month or about $325 per year for their healthcare. As of January 1st, 2026, however, that payment jumps to $130 a month or $1,562 per year. That is an extra $1,238 out of the barista's pocket after taxes. You better tip your goddamn barista. Now, case study number 2 is going to be content creators. People like myself, people that you watch every day on your social media feeds. Let's say that these content creators make right around $45,000 per year. Currently, their health insurance premiums are sitting at $229 per month or right around $2,475 per year. But next year, January 1st, 2026, that payment is going to jump up to $359 per month for a total of $4,311 per year. That's an extra $1,836 that comes out of the content creator's pocket after taxes per year. Y'all, I'm going to have to stop doing educational videos and start selling feet pics. Now, the last case study is the absolute craziest, guys. Let's take a 60-year-old retired married couple. That's your grandmama and your grandpappy down in Florida. Combined, they make a joint salary of $85,000 a year. The current tax subsidies for the Affordable Care Act make sure that they can only be taxed at 8.5% of their yearly income, right? So only $7,225. This makes their payment $602 per month. As of January 1st, 2026, their monthly health insurance payments are going to 4x to $2,485 per month or $29,825, $30,000 per year, y'all. $30,000 per year. That is an increase of over $22,000. That is not a typo. That is the barista salary. That is a goddamn mortgage. That, my friends, is disgusting. And let me just jump in here and say that for anyone making over $25,000 per year, this affordable health care wasn't all that affordable. And that's because the last time we had a rate increase that brought us to these levels, guess who was in office as president? And guess what he was trying to do? Yeah. And for all of you people that think that you are safe because you have insurance that is sponsored by your job, you're not. There is a phenomenon called cost shifting. Go ahead and comment that below, and I'll do an entire video on the issues of why the Affordable Care Act being gutted by the big, beautiful bill is going to affect every single American in this country. Thanks, y'all. And I guess try to stay healthy because you can't afford to get sick.